Hey class, in this video we are going to talk about the yin and yang disorder. In the yin and yang disorders, we're going to talk about the yin deficiency and yin depletion, yang deficiency and yang depletion. So especially these are the deficiency syndromes of yin and yang. The only difference between these different terms is also the volume of yin and yang. Indeficiency. Indeficiency refers to in the body we don't have enough yin fluid. So now we talk about yin. What's yin in the body? So it can be blood, it also can be fluid. And the yin deficiency will result in hyperactive yang. So that's also we call deficiency heat. In this condition, if the body has yin deficiency, it will lose the function of nourish. So that's the function of yin, the yin function, nourish the body. That's why the patient will present with dry throat, feverish sensation in the palms, the soles, and in the chest. So the feverish sensation in the palms, soles, and chest. The palms, soles, and chest in Mandarin we all call heart. So the palms in Mandarin we call the hands heart. The soles in Mandarin we also call the feet heart. The chest is where the heart sits. So you got two hands, two soles, plus the heart in the chest. That's five hearts. Five hearts. So that's why when you can hear about sometimes in some books they will talk about five hearts, hit. So five hearts hits. What's the five hearts? That's from the palms, soles, and chest. The hot feeling, the hot sensation in palms and soles and chest, we also call the five heart heat. That's very typical for the yin deficiency. Feverish sensation, tidal fever. You still remember what kinds of fever is tidal fever? Night sweat. That's also yin deficiency. So if you don't remember the tidal fever, go back to the inquiry, to the notes and the textbooks. Dry mouth, dry throat, weight loss. That's because the yin fails to nourish the mouth and throat because we don't have enough yin. The key points from the yin deficiency, tidal fever, night sweat, and also very typically is the hot sensation in the palms, soles, and chest. So this manifestation is very typical for yin deficiency. The yin deficiency, the tongue can be red or deep red with scanty coating. So there's not a lot of coating. The pulse can be thready. So these are the typical manifestations for yin deficiency. Similar to the other syndromes, when you talk about a new syndrome, we always talk about the causes. What can be the causes for yin deficiency? So yin deficiency is a kind of syndrome that you don't have enough yin in the body. So you can think about what can cause the lack of yin, such as after heat, a heat syndrome. after heat syndrome or after heat syndrome for long term, so the heat will consume the yin in the body. It can result in yin deficiency. Emotional stagnation. Emotion problems result into qi stagnation, and the qi stagnation can cause the heat syndrome. That also can result in yin deficiency. For especially from the sexual life, excessive sexual life also can result in yin deficiency. Also, the yin deficiency can be a result of the treatments. So the wrong treatments or improper treatments after long term also can cause yin deficiency, especially when patient taking hot herbs with hot property or with the acupuncture points, acupuncture or moxibustion. After too long, it also can cause yin deficiency syndrome. The yin deficiency syndrome also sometimes will combine with the qi deficiency. So if you goes to qi and yin deficiency, in this situation, the patient will present with tired fatigue and the yin deficiency syndrome. The reason is because the relationship between qi and yin also link together. When you think about yin, you think about the blood and fluid. So for yin deficiency, most importantly, remember the 5 hearts, the hot feeling, can be tidal fever and night sweat. Red tongue with scanty coating, that's a yin deficiency, sweaty pulse. Yang deficiency. So yang deficiency is opposite to yin deficiency. In this situation, we don't have enough yang in the body. When we don't have enough yang in the body, we need to think about what's the function of the yang qi. The yang qi have the function of promote, of warming and transform. So this is the function of yang qi, warm to promote and to transform. That's why if we don't have enough yang qi in the body, the patient will present with cold lumps, cold intolerance. Transforms. The patient can present with thirsty but prefer to drink hot drink or hot water. It also can be an absence of thirsty. So either no thirsty or thirsty but prefer hot water. Why the patient will present with thirsty? That's because of the transforms. The water we drink from your mouth, the water, because of yang deficiency. So the spleen could not transform the water to the fluid in the body and ascend to the mouth. That's why we will feel thirsty. But this thirsty, we don't want to drink cold water. We want to drink hot water because of yang deficiency. The hot water can improve the yang in the body. So either there's an absence of thirsty because of yang deficiency can cause coldness, and the coldness will not consume the fluid. So that's the possible manifestations. Yang deficiency also will result in a coldness. That's because of the warming function of yang qi. So the patient can present with coldness. The coldness can be in the lumps. Also, it can manifest as clear perfumed urine, pale complexion, pale tongue. So when you study here, you shouldn't confuse yang deficiency and qi deficiency. What's the difference between the yang deficiency and qi deficiency? These two are quite similar. Yang we also call the yang qi, qi deficiency and yang deficiency. The reason why we separate them is because qi deficiency, we more focus on the function of qi, to promote the activity. Yang deficiency, we more focus on the warming function. So yang deficiency, the patient will present with qi deficiency symptoms, also fatigue, plus cold condition, cold intolerance, cold lumps. Because you need to remember that yang is a heat. If we don't have heat in the body, we will feel cold, internal coldness. So coldness plus the qi deficiency syndrome, even fatigue, tender enlarged tongue. That's because of yang deficiency can result in water retention. So that's the difference between yang deficiency and qi deficiency. Qi deficiency, we more focus on the function of the movement. So the qi deficiency, the very typical symptom is fatigue and will be aggravated after movement. Short of breath also will be aggravated after movement. Yang deficiency, the patient always tell you cold lumps and tired. So for qi deficiency syndrome plus coldness, that's yang deficiency. Then what's the possible cause? What's the possible causes of yang deficiency? Chronic diseases may result in yang qi deficiency. Yang deficiency also can be a further stage of the qi deficiency. Yang deficiency also can present in patients who stay in a cold environment or in a cold working or living environment for long. Yang deficiency also can happen in patients who take cold herbs for long. Yang deficiency also may happen in senior age, because the senior age people always have yang deficiency. Yin depletion as a critical condition due to severe consumption or exhaustion of yin fluid. For this session, we're not going to talk in details. The reason is the blood collapse, the fluid collapse, and the yin depletion are very similar. You cannot separate them. The reason is yin depletion refers to blood and fluid depletion or blood and fluid collapse. Although we didn't mention the fluid collapse, that's because just a more severe condition of insufficiency of fluid. So you will see the manifestations are very similar to the blood collapse. Why in this situation the patient may still present with hot, sticky sweat or hot skin warm to hands and feet? Why the patient can present with something warm That's because of yin depletion is a further stage of yin deficiency. So from yin deficiency, the patient will have deficiency heat. That's from the hyperactive yang. That's why the patient can present with these hot sensation. Most importantly is the oily sweat. That's the oily sweat. This is not easy to see because this is a critical condition. In depression, the next stage is death. So this will be a very critical condition. Yang depression is also a critical condition. It presents as cold sweat, cold hands and cold feet. It's also a critical condition due to extreme weak of yang qi. The next stage of yang depletion, also the death. So these two symptoms are not easy to see, and also because of the development of medical levels, the yin depletion and yang depletion, although the next stage can be death, but due to the medical levels, such as the emergency service, nowadays sometimes we can rescue this kind of situation, such as the yin depletion. So yin depletion is a severe consumption of the fluid in the body. So we don't have enough fluid in the body. In this situation, now from the emergency service, we can use the fluid, we can put the fluid to the vessels directly. We can put the blood to the vessels directly. So this can save some conditions of the yin depletion. But we just need to remember that if you see these kinds of manifestations, this is a critical condition. The difference between yang depletion and yin depletion. You also can compare with this table to the qi disorder and blood disorder. The last session, we're going to talk about some conditions among the qi, blood, and fluid factors. This is very similar to the other session, but although when we study one by one, but these manifestations, sometimes they will happen together. The first one, qi deficiency of qi and blood. So in this situation, the patient presents with both qi deficiency and blood deficiency. When you see the manifestations, you will see that the manifestation very similar. You put the manifestations of qi deficiency and blood deficiency together. So the patient will present with fatigue. The patient will present with blood deficiency, dizziness, blurred vision, palpitation, dream, disturbed sleeping. So what's the reason? This kind of fatigue will be worse, or no desire to talk will be worse upon movement. So that's qi deficiency. And this is also very common to happen together. That's because the relationship between qi and blood. Blood stasis due to qi deficiency. So this situation, the patient presents with blood stasis, with stabbing pain, with fixed position pain, and purple maturation with clots, purple or with spots in the tongue, hesitance, pulse. So these are all blood stasis symptoms. But in the meantime, the patient presents with fatigue, reluctant to talk. So you see, we use different tones to describe, but similar. They must present with shortness of breath, spontaneous sweat, and also it will present these symptoms will be worse upon movement. So these can happen together. And also from the treatments, the reason why we need to study these combinations is because such as deficiency due to qi and blood. From the treatments, we're going to tonify the qi and blood. For qi deficiency syndrome, we're going to tonify qi. From blood deficiency syndrome, we're going to tonify the blood. But for this qi and blood deficiency syndrome, we're going to tonify qi and blood. For this blood stasis due to qi deficiency, from the treatments, we're going to activate the blood circulation. In the meantime, we're also going to tonify the qi. So that's the treatment principle will be different from blood stasis syndrome. Qi failing to constrain blood. Qi is supposed to constrain the blood to keep the blood in the vessels. If qi fails to keep the blood in the vessels, it will result in bleeding. Bleeding in the urine or stool, in the gums, heavy menstruation, that's pale color, pale complexion. So you see heavy menstruation, if with dark red with clots, or heavy menstruation with light red or pale color, that's a very different situation. With a pale color or light red, that's qi fading to constrain the blood. The patient also, in the meantime, presents with fatigue. All these manifestations with qi deficiency. Qi stagnation and blood stasis. In this situation, the patient presents with both qi stagnation and blood stasis. So you will see the manifestations. You can have both blood stasis, amenorrhea, dysmenorrhea, clots, qi stagnation, pain, distending feeling in the lower abdomen, in the chest, in the breast, depression, liver qi stagnation, stabbing pain, that's the blood stasis. So in this kinds of manifestation, in the treatments, we're going to activate the qi circulation and activate the blood circulation. The qi collapse following the blood loss. This is referred to qi collapse after the blood loss. So especially for massive bleeding, severe bleeding, and after bleeding, the patient presents with qi collapse, faint breath, pale complexion, sweat, cold hands and feet. That's because of the qi, lose of qi after the blood loss. So we need to be clear that the explanation from Chinese medicine and acupuncture theory and the general medicine sometimes is very different. When we see a patient present with cold hands and feet in this situation, in Western medicine, in the general medicine, they will think that because of the massive bleeding, lack of blood in the circulation, it will cause the poor circulation in the body. That's why it results in the cold hands and feet. But when we study Chinese medicine, we see the same manifestation. We need to think about our explanation. What happened to the cold hands and feet? Although we also think that may be the result of bleeding, but that's not a direct result from bleeding. The cold hands and feet. Thus the bleeding causes qi collapse. Qi collapse causes cold hands and feet. That's because of the qi's warming function, especially the yang qi, the warming function. So that's the difference between the difference in the explanation from the acupuncture theory and the general medicine. The reason why we need to identify the difference between these two is because in this situation, such as the qi collapse due to blood loss, in this situation, how can we treat this kind of symptoms, or how can we treat this kind of problems? In Chinese medicine, apart from stopping bleeding, we're going to tonify the qi because we think that the qi is very important to constrain the blood. So the treatment we will tonify the qi. The other reason is also because it is very hard, although now it's become simple in the hospital. They can put the blood in the vessels directly, but in the past, we don't have this kind of technique to create the blood. We have explained in our basic theory how do we create the blood. The blood needs to come from the food to the stomach to the middle jiao. The middle jiao transforms the qi to the heart, and the heart transforms the qi into red color, then become blood. So this whole process takes time. What's more important in this process, especially for blood loss, that's the qi. We need to confine the qi, we need to tonify the qi, and then the qi will promote all these processes. You cannot tonify the blood directly. You need to go all the way from the beginning. That's why in the treatment, tonifying qi is very important. That's the difference between Chinese medicine and Western medicine. Qi, especially yang qi, is very important in our theory. Qi collapse due to fluid loss. This is very similar to the blood loss. The difference is only one is the fluid, one is the blood. The causes can be different, such as from the blood loss can be different kinds of bleeding. Fluid loss can be sweating, severe sweating, vomiting, or diarrhea. So you can just go through by yourself. The manifestations are very similar. Deficiency of fluid and blood. In this situation, the patient will present with both manifestations of fluid deficiency and blood deficiency. The reason why these two will happen together is because the fluid, the source of fluid and blood, they come from the same source. So that's from the basic theory. Where does the fluid and where does the blood come from? So the manifestations, also the combination of these two. Phlegm and bronchitis. In this situation, the phlegm can block the meridian and block the pathway where the blood moves, so that will result in blood stasis. This is also the combination of the phlegm symptoms and blood stasis. The treatment is also going to clear the phlegm and activate the circulation, activate the blood circulation. Joint enlargement or deformation, that's from the phlegm. Qi and yin deficiency. In this situation, the patient can present with Qi deficiency symptom and yin deficiency. The last one is the Qi yin and yang deficiency. In this condition, both yin and yang deficiency. You can present with spontaneous sweat, night sweat, something awake, something during while sleeping. So night sweat doesn't mean at night. You still remember the meaning of a night sweat. This night sweat refers to sweat while sleeping. Spontaneous sweat refers to sweat while awake. That's Qi deficiency. That's Yang deficiency. Yin deficiency, the patient can present with the 5 hearts of the 5 hearts hot sensation, dry mouth, dry throat, tidal fever. So that's the Qi and Yang, Yin and Yang deficiency. There can be more symptoms that they happen together. Here we only mention some of them as an example. As you can see from here, the study all the symptoms between different causes, it's very simple. You only combine with different manifestations, so you put them together. And in future, when we study 脏腑 differentiation, you only add that if the patient will present with the other symptoms in specific organs, you can add here, such as Qi deficiency, or here yin deficiency. Sometimes it's not enough for diagnosis. It is not enough for the treatment, because yin deficiency, it can be the lung yin deficiency, it can be the heart yin deficiency, it can be the kidney yin deficiency. So we also need to identify, we need to locate where they are. Then we can focus on the treatment towards yin deficiency, heart yin deficiency, or kidney yin deficiency, or lung yin deficiency. So in future, we will plus the 脏腑 location. From here, you need to remember one by one. Then it will make you much easier study the later information. There's one gentleman, 42 years old, presented with dragging and distending sensation in the mouth, in the stomach and abdomen for the last 3 years, aggravated for a month. For the 3 years, it will occur after meals. 1 month ago, the condition became worse due to overwork. Now he has this sensation, especially after meals, accompanied by lassitude and poor appetite, loose stool. The patient has a weak constitution and pale, tender tongue, thin white coating, a weak pulse. How to diagnose? how to analyze these different symptoms. Lassitude, poor appetite, and loose stool. So in future, you will know that this is the spleen deficiency, overwork. So these are some of the key manifestations after meals. When we see from the manifestations, the patient presents with poor appetite, lassitude, tender tongue, and weak pulse. That's from the qi deficiency. So that's the manifestations of qi deficiency. And the distending sensation. It can be the qi deficiency results in qi stagnation. The distension in the stomach and abdomen, loose stool. In future, when we study the Zangfu differentiation, we will know that these manifestations are due to the spleen and stomach. And also from the cause. The cause, it mentions that all these symptoms happens due to overwork. So these become worse upon movements, overwork. So overwork, that's the kind of movements. After overwork, these become worse. Something become worse after movements. That's qi deficiency. So and then in future, when you at the spleen, when you see the abdomen, when you see the loose stool, you will know that's spleen. So this patient presents with spleen qi deficiency. And in the treatments, we're going to use acupuncture points to improve the qi deficiency, especially for spleen qi deficiency. And then from the treatments, we will choose some acupuncture points in the spleen meridian, in the stomach meridian, which can tonify the qi. That's how to treat this kind of patient. Thank you for your attention.